What's going on, YouTube Nation? We will be discussing the proper and improper way of tying tourniquets that will either highlight a lot of vein candidates or you may feel faint veins, depending on the tension of the tourniquet. So master this technique and your job will be very easy. Let's not waste any time. Before we find the vein, and certainly before drawing any blood, it is imperative to understand how to apply the tourniquet the correct way. To not only feel for veins that are visible, but also to feel for more candidates so that we can have more options to choose from if needed. But be careful in the arm because you will have tendons which are going to feel long cord-like structure. Veins can lie next to tendons, but we have to make sure that we don't poke the tendons. We also have muscles and we also have nerves deep inside. But you have to put the needle that deep in order to get to those nerves, which we will learn how not to do. If you start feeling for a vein and it starts pulsating, that means that you are pressing on an artery. So do not poke it, because your arteries are going to be under high pressure, while veins are going to be under low pressure. Patients may also have scar tissue, especially if they have just one or two veins that just get poked visit after visit every single time labs are drawn. Not everyone will have excellent veins. Some have regular sized veins. You're going to have patients that have scar tissue, but we never want to poke it thinking it is a vein. Once you start to notice the texture of scar tissue, you'll feel the difference between the two. So we want to learn how to apply the tourniquet the correct way. First, let's put the tourniquet on loose. Tourniquets are reusable after being cleaned. We're always going to apply the tourniquet over the clothing to prevent pinching the skin, especially seniors. Get some good tension. Stretch it. However you want to apply the tourniquet, do whatever works for you. Everybody will develop their way of tying a tourniquet, so pick and choose whatever way is comfortable for you. We all learn from somebody. So this is going to be loose. And the tourniquet is weakly applied. Failing to compress the arm, that's exactly what we do not want. This tourniquet must be on snug so that we can firmly compress the arm. And we're also squeezing from the shoulder all the way down towards your antecubital fossa area so that more veins can rise, either more to the surface or at least they'll rise more so that you can feel them better. But if the tourniquet is going to be loose, we're not going to feel it the way we like. Feel free to tie the tourniquet however you choose fit, as long as it's going to compress the arm. So once we start having it on the patient's clothing from the shoulder, we're going to start squeezing straight down towards its AC area, getting all those fluids ready for this target area, making our work easier. If we don't do this right, we're not going to have visible veins the way that we should. If we have the tourniquet on correctly, this is an extremely important step that cannot be neglected. We must learn how to put the tourniquet on correctly. Then everything else after that will be light work for you. Everything will come easier after that. Now start feeling everywhere. Even if the vein is prominent, even if it's right here, the goal is to locate additional options for us to choose from. We're going to start squeezing all the way down, continue. If it makes it more visible, but we just have to keep in mind when it comes to senior patients, some can be very sensitive. So if we're squeezing too hard, ask the patient and the patient will let us know whether to do it lightly. Or if it hurts them completely, you can always press or feel like this. As long as you're feeling everywhere, that's it. You can feel free to squeeze it, press on it, whatever it is you want to do. The mission is to find many veins, therefore many options to choose from. That's exactly why we need the tourniquet on right. And if we don't apply it correctly, then we're just going to have a bad day at work. Feel where the vein starts and ends. Phlebotomy can be challenging, but if you master the basics, then you will have no problems drawing blood from any patient, whether they are easy stick or a hard stick. It does not matter. In the real world, not everybody will have veins that are going to be an M-shaped or an H-shaped. Everybody will have different anatomy, blood vessel structures, different locations. After squeezing, we now feel around the AC area. On this thumb side, you're going to have your cephalic veins. And on the inside of the arm, you're going to have your basilic veins. These will be the last choice because a brachial artery is close by, so don't disturb them. It's going to be too close, so don't chance it. But if you have a good AC or a medium cubital vein, go for it. Then on the outside, this will be your cephalic veins, which is going to be on your thumb side. There are many cephalic veins to choose from. That will be the second choice, but our first choice will be the straight median cubital vein. This is running down, but sometimes you can have it running across. That's why everybody's anatomy will vary. All patients are going to have different size veins, shapes, and sometimes you may even have a vein that's not going up or diagonal. It's actually going horizontal. I've seen plenty of patients that have these type veins. That is fine if you just want to feel where that vein is. Whether it's going to be a cephalic, median, or the outside area. Your basilic veins, these will be your last choice. This will be your first choice, and the second choice will be your cephalic veins. And once you find your target, then set up all your equipment that's necessary for that type of vein and draw the blood. And that's all she wrote. Thanks for watching. Click on the next video to keep learning phlebotomy.